Could you define what is postpartum blues compared to postpartum depression and um, some of the mechanisms? I know it's kind of not really well known. What exactly is this condition? If you could describe what we know.
Yeah. So, and that's the thing. We have all these terms, and what I actually noticed in my own personal experience and also from taking care of my patients is that there's a lot of cutesy names that we use to label a woman's status once she gives birth. So if you think about it, I always say when you give birth, you die and you're born again and you lose the person that you used to be and you are now a new person, and with that comes a massive loss of fluids, major fluid shift in your body, and then most importantly with that, then you have a major shift in the two major hormones, good old progesterone and estrogen. And that tends to be where we see postpartum depression born. Now, we call baby blues the first 2 weeks, and we tend to normalize baby blues, which I have very personal opinions about, and I can go into that. But pretty much, what's the difference between postpartum depression and baby blues and regular old depression? Really, they're all one and the same, and it's more so a timeline. So typically, when we say someone has major depression, they're having issues with sleep, either sleeping too much or not sleeping enough. They have very little interest in activities or things that used to make them very happy. They have feelings of guilt, like they're not enough, or very self-conscious of why they're even here, or guilty that they even exist. Low energy levels, poor concentration. They can't eat. They can't seem to move right. For a lot of patients, it's either they feel like they're like this 1,000-pound boulder, and it's so difficult to move their body. Or for some other patients, it's that they're so jittery and that they can't sit still. And then in the most severe cases, then we can also see thoughts where patients have thoughts of wanting to harm themselves. So with, good old depression, we see that across, males, females, all ages. And then we define postpartum depression as those symptoms coming about for 2 weeks or more within the first 12 months of giving birth. Now, that's kind of weird that we call it just within the 12 months, because actually what the newest studies show is that it takes 6 to 7 years for a female to actually recover both physically and mentally from giving birth. So, if I have a woman that comes in and says, I have a 5-year-old and I've been struggling with depression, it's like, I'm still going to call it postpartum depression. I'll be honest with you, because if the symptoms really started after birth, then that's what we're going to call it. Baby blues is going to say that you're having these feelings within 2 weeks, and it's less than 2 weeks, and sometimes it's more just like a couple days. It's kind of a cutesy term, in my opinion. A lot of times I actually see I used to do consult liaison psychiatry, where I was actually taking care of patients in-house. Baby blues to me looks more like a mild delirium, where the mother is like kind of detached from reality. They're really sleep deprived. So there's a lot of terms that kind of get thrown around, and it's really mostly based on timeline.
And there's also postpartum psychosis. I assume that is the severe cases. Is that correct?
So scary. So that's the thing, postpartum psychosis. And like, if there's one thing for listeners, whether you're a clinician or you're a patient or you're a family member, to take away from this podcast is, if you see that the mother is actually detached from reality and she's having any sort of first rank symptoms of psychosis, for instance, feeling very paranoid, hearing things, seeing things other people can't hear or other people can't see, and really, really detached perceptually from reality, that's postpartum psychosis. That is a terrifying state for the mother to be in. And really the biggest concern is the safety of the child. So that's where you go to the emergency room or you call 911 immediately, because that mother is probably not going to be disclosing a lot of what's actually going on in her mind. It is very difficult for me to be convinced to let a mother go home when she comes into the emergency room or she comes into my clinic when she has postpartum psychosis. It's like, nope, we got to get you in. We got to fix this before you can, be with the baby, because that's where the really tragic stories happen.
And it's not only affect the mother, it affect the child as well, and sometimes the family. Is that correct?
It's so hard. And it's so hard on the families, because, when you have a baby, the whole world is just like, it is turned upside down. At least for me, it was when I was a COVID mother. And everyone is so worried about the baby. And a lot of times they forget about mom, right? And the really hard thing for the baby is, especially within that first month, there's so much happening in terms of the baby just came out into this world where it's cold and it's loud and there's lights everywhere. And then the mother's not able to actually attach or bond with the baby. And that can have some serious implications on the child's development in terms of being able to hit those milestones, in terms of being able to just be a well-regulated child and adult. So that's why the sooner you're able to catch those symptoms and seek treatment, the better.
Maybe could you go over some of the risk factors for these conditions?
Absolutely. So, and when we look at risk factors, again, it's a spectrum, right? So, a lot of times what we see is a mother coming into pregnancy and she has a history of depression and anxiety. Maybe she's been on medication before, maybe she hasn't. Maybe she's been going to a therapist, maybe she hasn't. But that tends to be a big one is, clinicians, please always ask your patient, do you have a history of depression? Do you have a history of any sort of mental illness in your past? Does your mother have any history of having had postpartum depression or any sort of mental health issues? Either, again, it always ticks up your risk factor if it was within the postpartum period. It also kind of helps to look at the mother's mother, so grandmother, right? And see if there were also any major mental health changes that came about with menopause. Because that tends to tell you, oh, this is a hormonal related issue potentially. So, those tend to be my biggest risk factors for patients is if you've had it, then I have to keep an extra close eye on you. Another major risk factor is, again, the lack of social support or the lack of even like financial resources. So how often are you going in to see your doctor? How many people are in your support network to keep an eye on you and make sure that you are doing okay after the birth period? If you do have, someone to take care of baby while you go and catch a couple hours of sleep. Also nutrition. So I have a lot of patients, we live in beautiful Orange County here, and I tend to have a lot of mothers that will restrict themselves very, very, very badly during their pregnancy periods. And so then they are nutritionally not optimized for that postpartum period. And then all of a sudden their body is not only trying to recover from giving birth to a human, but is also trying to lactate to feed that human. So then again, it's like we are only so much. And if you're draining and draining and draining your body, something's got to give.